Okay, so I wanted to quickly just talk a little bit about Small Bangladesh. I'm sure most of you know what we do, but I thought I'd just quickly talk to you a little bit. And then we have a video from our last mission in March that I wanted to show. So basically, we are a medical nonprofit that was basically founded by a group of friends from Columbia Presbyterian. And we've been traveling to Bangladesh since 2006. And our basic mission is to provide surgical, medical, and dental care for children with cleft lip and palate deformities. So in the last 6 years, we've treated over 600 children, which is more than I ever imagined we would do when we first started this. And our next mission is actually, we're leaving the Monday after Thanksgiving for 10 days, and we're going to Cox's Bazar, which is the very southeast corner of Bangladesh. For those of you who don't know, Bangladesh is a tiny nation. It's about the size of Idaho, just to the east of India. Even though it's small, it actually has 162 million people in it. So it's actually the 8th or 9th most densely populated country in the world. Within that population, it's estimated there are about 300,000 children and adults with unrepaired cleft deformities. And the main reason that there are so many is that there's basically no care. There's about 20 surgeons in the country with formal training in cleft surgery, which translates to 15,000 children per surgeon, which is basically an insurmountable task to overcome. More importantly, most of the children are in areas that don't either have access to care nor can they afford care. Other issues for the increased incidence of clefting in Bangladesh is, unfortunately, there's a lot of poor prenatal nutrition, or malnutrition, I should say, during pregnancy, as well as early pregnancy. Typically, in rural Bangladesh, the average age for delivery is around 14 years of age. So the younger you are, the higher the incidence of birth defects. So the biggest issue with the treatment of children with clefts in Bangladesh is the fact that there aren't enough surgeons. The second issue is most of these patients just don't live in an area that they can access care. So that's where we come in. We are trying on both fronts to slowly address these issues. In one way, we are training surgeons when we go, and the other issue is we actually go outside of the cities to the more rural areas of the country. And at this point, we have about 3 or 4 centers that we go to on a rotating basis in all 4 corners of the country. So, so far everything is going really smoothly for us. One of the things that we're working on right now as well is to develop something called a multidisciplinary center. And for those of you who are involved in the States with cleft care, you know that a child with a cleft needs more than just surgery. It needs speech therapy, it needs dentistry, orthodontics, a lot of things that are involved. And unfortunately in Bangladesh there are none of these things. So we're actually working with the health ministry right now to try to develop a cleft center in Dhaka, which is the capital, to start kind of more advanced treatment. So again, these are the things that we're trying to deal with, where we're trying to slowly help make life better for these children. And it's a very slow process, as is most things when it comes to trying to treat children with clefts in Bangladesh. So the biggest issue with us is funding. At this point, we have basically the same core group of 5 or 6 individuals who go on every mission, and we travel twice a year, every November and every March. And at this point, we have a core team, and our missions are pretty well established and set. So for us to do these missions, it's at this point relatively easy to get them organized. The biggest issue is funding, and that's why we do these fundraisers. That's why we're very aggressive about going for grants and things, because each mission costs around $30,000 to $35,000. So if we're doing 2 missions a year, we're talking about $70,000 annually that we have to raise. And fortunately, we've been very lucky between the folks in this room and elsewhere for supporting us. So I thank you for that. So our team's basically made up of anesthesiologists, surgeons. Sometimes we bring a pediatrician. We have nursing staff as well. and administrator. Our goals really are to treat as many children as possible. So when you talk about cleft lips, there's basically two types. There's a unilateral lip, which means the upper lip doesn't full fuse on one side, versus a bilateral, which means it doesn't fuse on both sides. And this is an example of some of the kids that we see, and they're adorable, they're cute. And this is an example of unilateral cleft lips. Okay, and after surgery. Bilateral cleft lips are a lot more disfiguring and a lot more harder to treat. And this, for example, is a 3-year-old, and it's hard to imagine his life, walking around with this sort of an issue. We also deal with cleft palates. Cleft palates are basically holes in the roof of your mouth. And the issue with this is it's not so much aesthetic deformity as the lip is, but it's a functional problem, because as you can imagine, you can't really speak properly, you can't eat properly. So these are as important, or in many ways more important, to treat. Okay? The other issue that's unique to Bangladesh is, I've traveled to South America, for example. People in this room have traveled all over the world, and most of what we do outside of Bangladesh in cleft missions is we treat much younger children. But the interesting thing about Bangladesh is we see people from all ages, all walks of life. I've treated a 68-year-old with a cleft lip that was never repaired. So we, it's an interesting thing that you see much older kids, teenagers, walking around with these deformities. And that basically tells me that, they just don't have access to care. And that's why what we do is important. So I wanted to just show you a video now from our last mission. So hang on one second.
Mm-hmm.